All right, hi Tyler, it's Dr. Buford. We're just getting started on the right knee. We've already harvested two very nice hamstring tendons. They're sized out to about a 7.5 diameter, which is average for our ACL reconstruction. And now we're looking in the medial compartment. So we're going to take a spinal needle next, and we're going to check our placement for our medial portal. That looks pretty good. I'm going to rotate the camera around and make sure that we're above the meniscus here. Okay, that looks pretty good. So we're going to make another portal here. I'm also going to look in the notch. We did confirm that your knee was very loose under anesthesia, just so you know. And here, as we look in the notch, there's a little bit of ligamentum blocking our view, but we can see that with our needle, we can get all the way back. So we'll show you some more in just a minute. Pause. Pause recording. Okay, Tyler, so here's what it looks like in the notch. We've got a shaver in here. This is the remnant of your ACL. Remember, it tore off the femoral side. And so we're going to clean this up here so that we can put in a nice new graft. You can see it doesn't look normal in here. I know you haven't seen a bunch of these, but I'll show you a bunch of video in the office. But we know from the MRI that it tore off the femur and it dropped down, and your knee was obviously very unstable. So we'll go ahead and debride the rest of this and show you some more in a little bit. Okay, Stryker, stop recording. Okay, so we're looking in the medial compartment. This is the medial meniscus. Here's the posterior horn. We're checking the root, which is the very back of it. And this looks good back here. We've got this little probe in. I'm trying to clear the picture up for you just a little bit here. I can't tell if this one is draining or not. Pull. Pause recording. Okay, so this is the posterior horn that we were talking about. And it actually looks pretty good. We can see the meniscocapsular junction here. The body of the meniscus on this medial side looks pretty good. We were concerned on the MRI scan, and we always take a look, and this is actually looking pretty good. So it does not look like we're going to have to repair a meniscus today. And I'm happy for you for that. That's surgery you don't need. This is the notch that we've been working on cleaning out. We're not quite done doing that. Here's a little remnant of the old ACL that tore. And before we do any more there, we're going to look in the lateral compartment. Pause recording. Okay, so this is the posterior horn of the lateral meniscus. And as we often see in these ACL tears, there's sometimes a little tear in the posterior horn here. This actually looks pretty good. I'm going to rotate the camera around. So here's the root. That looks pretty solid. I don't see any significant tearing there. There's a little bit of a chondral injury. See right here? You're missing a little bit of cartilage right there. Nothing really to do for that at this point. We just want to make sure there's no loose bodies. And then as we push down on the knee a little bit, we'll get a look at the body and popliteus tendon back here. I'm going to open up the outflow a little bit. Okay. There's popliteus tendon back there running up towards about 11 o'clock on the screen. That looks good. A little bit of fraying on the inner edge of the lateral meniscus, but otherwise this is checking out okay. So I don't think there's any significant surgery to do in this compartment. We'll just note that you've lost a little bit of cartilage in the back here underneath the meniscus. When you weight bear, hopefully the meniscus will cover that right up and it won't be an issue anytime soon. Pause recording. Okay, so this is the part of the knee where the patella glides. It's called the trochlea, and as we follow the cartilage up, it's nice and white and smooth, like it's supposed to be. I don't see any signs of any cartilage injury in this part of the knee. The patella is at the top of the screen. A little hard to see right now, but we'll fix that in a minute. You just got to get a little bit of flow here, and then that'll clear up. So that's your kneecap at the top of the screen. We can look over at the medial facet. That looks fine. The lateral facet looks good too. And like I said, we're going to clear up the picture and make sure, but I just want to give you an initial view of what we see when we get started here. Pause recording. Okay, so here's the hole in the tibia. This is a size 8mm tunnel. In just a second, we'll put our shaver up. You can see how that runs. Your graft is going to run up towards the back of the knee in that direction. And that looks like a good position there for you. Pause recording. Okay, so here's the femoral tunnel. You can see our suture running through it. That's the same suture we used to run or to pull up our new graft. And now we're going to make some measurements and make sure that we have this in good position and have the length appropriately sorted out for you. I just want to show you what that looks like in this interval step. Pause. Pause recording. Okay, so now we're looking at the graft. You can see our little purple line that we use to make sure we're putting in the appropriate amount of graft, and we hit it right on the nose there. That looks good. We haven't fixed the tibial side yet, but the femoral side is fixed. And so you can see our position there right in front of the posterior cruciate ligament on the right. So we're going to go ahead and fix the tibial side, and then we'll show you the final picture. But that's basically what it's going to look like, since you won't see the tibial screw. So I'm really happy with that position. We're going to go off on the video for the moment. Pause recording. Okay, so here's the graft in position. It's now fixed on both sides. It looks very good. The stability looks good. It's got good tension on it. I'm actually tugging on the knee there, and it's not budging at all. So I'm happy with the way that looks. We have full extension, as you see there, and I'm happy with the way that looks. So we're going to finish up here and get you back to the recovery room. Good luck to you now. Bye-bye. Stop recording.